In this Get Pregnant Now quickie, we're going to be diving into magnesium, a mineral that your luteal phase needs to thrive. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? Here's what you'll walk away with today. You'll learn why magnesium is essential for progesterone, implantation, and cycle stability, how magnesium directly impacts PMS symptoms, stress, and inflammation, and simple ways to restore your magnesium levels for fertility success. So, why does magnesium matter for the luteal phase? Your luteal phase is your body's implantation window. And this phase is dominated by progesterone, or at least it should be. Unfortunately, progesterone is commonly low for women, and magnesium is essential for healthy progesterone levels. It's important for progesterone receptor sensitivity, hormone signaling, blood flow to the uterus, nervous system regulation, and reducing uterine tension and cramping. And when you have low magnesium, which many of us do, it can contribute to a short luteal phase, PMS, cramping, insomnia and anxiety, low progesterone symptoms, difficulty sustaining implantation. So let's talk about the magnesium and progesterone connection. Magnesium supports many enzymatic reactions and communications in the body that produce and regulate progesterone, while also calming cortisol, and cortisol and progesterone can compete for each other. So when magnesium is low, our stress tends to be higher, progesterone is lower, and implantation becomes pretty much less reliable and less capable. So this is why so many women see their luteal phase stabilize once magnesium is restored. So let's talk about some food sources of magnesium, because obviously food first. So fertility-rich magnesium foods include pumpkin seeds, dark leafy greens, avocado, raw cacao, almonds, Brazil nuts, wild caught salmon, black beans, and quinoa. And what has really been happening today, unfortunately, is our modern day and age soil is extremely depleted of nutrients, magnesium especially. And, even if you are eating organic foods, organic produce, that soil is commonly still depleted in magnesium. So that's why it's really important to either grow your own food if you have the ability, or to create relationships with local farmers and talk about if they practice restorative farming, which is essentially restoring the soil, which is going to give more nutrient rich produce and food. So, how can we support our magnesium with supplements? If you've ever looked up magnesium, maybe you've gotten overwhelmed. There is a plethora of different types of magnesium, and a lot of them are better suited for different things than others. So, magnesium glycinate is my absolute favorite. It's very bioavailable, it's excellent for stress and for sleep, which we know both are important for a healthy fertility. Then there's also magnesium threonate, which is really helpful for nervous system support. We have magnesium malate, which is great for energy. And then magnesium citrate, which is actually helpful for constipation if that is something that you struggle with. Typical fertility support, you may be looking at around 200 to 400 milligrams nightly, but this is very individualized based on your symptoms. Also on the supplement as well, you always want to read the directions on the supplement, and you always want to consult your provider before starting any new supplement. So here are some signs that your luteal phase may need some support from magnesium. If you experience any PMS symptoms, if you have breast tenderness, cramping, anxiety or insomnia after ovulation, spotting before your period, and shorter cycles or shorter luteal phase, because these are not normal symptoms. They may be common symptoms, but really they're signals from your body that something isn't right. And progesterone is our calm and carry on hormone. So if you're experiencing any of these, it's because your progesterone is struggling, and magnesium is one of the nutrients to help support your progesterone levels. So let's recap. Magnesium is essential for progesterone signaling and implantation. It directly calms stress hormones that suppress fertility, and restoring magnesium often stabilize the entire luteal phase. So I just want you to anchor this in. Your cycle isn't fragile, it's responsive. And sometimes the most powerful fertility shift begins with something as simple as restoring a mineral your body is craving. So if you are struggling with your luteal phase, with your progesterone, and you want to test and not guess, you want to uncover the real reasons you haven't conceived yet, book your free fertility strategy call and create a customized roadmap to restore your fertility, your progesterone, your luteal phase starting today. The link is in the show notes. Thank you so much for listening. I hope you have a beautiful, gorgeous day, and I'll see you in our next episode, released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.